Hello, everyone. Thank you for being here.
Yes.
Dr. Owaye.
Thank you
Today
so much.
we're going to be talking about potty
Potty
training.
training.
So, Dr. Owaye, take it away.
Okay.
Thank
so
you.
potty training is basically we're looking at is a child ready to be trained in the sense that the child doesn't urinate bedwets anymore or even defecates on himself, as simple as it is. That's what potty training is. So you're training this child to be able to go use the restroom, sit down on his potty chair and urinate or poo. And usually most children attain this at least before 36 months. But this child has to be
36
ready.
months, that's 3 years.
Yes, a lot of children are able to have
before 3 years. Okay.
Yes.
Okay.
So between those, literature will tell you between 18 to 36 months, at least you start potty training the children and they're able to attain some level of continence one way or the other. But the child has to be ready. You can't force the child to start the process. So this child has to be ready. How do we know a child is ready? So you see that the child is interested in sitting down on the potty chair. So you, as a parent, you need to get a potty chair when we get to that age of when you want to start potty training. Mm-hmm. So the child wants to sit on the potty chair. The child knows how to pull down his her panties. Right. Even if it's the diapers, they want to take it out and use the potty to urinate away. Or they see us as adults, we'll go to use the restroom to wee. They want to imitate us. So do you know that this child, there's some form of readiness, and then you can then kickstart training the child. But the timing of the training is very important. Why do I say this? Because if a child is ill, that's not the best time to start potty training the child. If a child wants to start, because you're starting crèche tomorrow or next week, we're going to start training you
today. In 1 week, the child should know what to do.
That's not the way it goes. Yeah. So, or if there are stressors in the environment, maybe a new sibling. I always call it new sibling.
That's a big stressor for an 18-month-old.
Exactly, a new sibling. Who is this?
Who's that? Why are they getting all the attention? And I'm right here. Right. It's almost territorial that they've come into my space.
Yes. So that's also not a good period to start. Yeah. So you have to look at the timing. The timing matters for a child to be fully ready to kickstart potty training.
Yeah. But some parents will be like, Doc, if I don't force this child to use the potty, they'll be in diapers for the next 5 years.
You can't force a child. You can't force a child. When the child is ready, you see the signs and you have
some children, when they've peed on themselves, they're like this. They can't sit still.
Yes.
So that's an indication that, and if they've pooped, they also are
not comfortable.
Yes.
They're not comfortable.
Generally, I think girls tend to potty train
earlier than boys, one way or the other.
And sometimes when a child has autism, it takes forever.
It takes, yes.
They're just not interested.
So you must exclude a child with any form of global developmental delay.
Yeah.
Developmental delays, of course, we know that they won't attain good continence at the right time as we expect them. So
you give them signs. If they go and hide when they are trying to poop, then you know that, okay, you're not hiding anymore. You're going to sit on the potty and do this thing here.
On the potty.
So if a child is not wanting to potty train and they are getting to the age of 5, 6, what do you do?
That's worrisome. So for such kind of child, first of all, you must encourage. You have to reassure the child. You have to reassure the child, encourage the child. Find out if there are factors that are making this child not to get potty trained. So is there a urinary tract infection? Is this child constipated from time to time? Yes. So that they will identify some factors and you look out for those factors and make sure that you treat it if need be or manage it if need be.
Yeah, because some children, if they've had hard stools and they're constipated, they have what is called stool withholding because it's almost like a negative experience for them to try and poop. And if they've had stool that has had blood in it from just very hard stool that has stretched the rectal or the anal opening or the rectum, they're extremely uncomfortable. So they don't want to poop.
They don't want to poop.
We are trying to put them on the toilet. They are screaming and crying because it's associated with discomfort of pain.
Yes.
So the most important thing is to treat the underlying cause, like constipation. You want to make sure your child is eating more fruits, more fiber.
Yes, properly hydrated.
And put them on a stool softener like Miralax or lactulose. Or any of the common ones, and then put them on the potty. Sometimes you might need to encourage them.
Yes.
So what we tell parents, get those potties,
fancy, beautiful
potties that even sing. When they have pee in there, some potties will play their favorite tunes. they might need to do that. Or parents become cheerleaders. Okay, it's time to go to the potty.
Exactly.
And then you can even, once they pee, you can make a potty dance for them. And then they get so excited. They're jumping and dancing with you.
Yes.
Or have a special song that you play when they are in the potty so that they can
read a book to them.
Yes,
sing
and just make it a bit more special.
Yes.
Yeah, I think that
having
definitely.
timings also help.
Yes.
So it's
and then
very
putting them like to go every 2 hours.
Every 2 hours.
Have them sit down on the potty. And once they go, make it a big deal. Yeah, sorry, you were going to say something.
No, it's what you're saying. Having the timings for when they need to go use the potty and let them stay there for at least 3 to 5 minutes, not for 1 hour.
Yeah.
2 hours, 3 to 5 minutes.
Yeah.
And
if you don't potty, you're not getting up from there for 2 hours.
No,
that doesn't work.
That doesn't work at all. That doesn't work. So you need to really encourage the children a lot
to do that.
To do it.
So that, and parents need to be patient, because on average, how long does it take to potty train a child? That's the other question. If I start putting them on the potty every 2 hours today.
Sometimes between 6 to 12 months, some children could delay. But on an average, within 6 months, you're good. You're good to go. You're good to go. So it's an important topic for all mothers, I guess. A lot of mothers look forward to it.
Yes, first time moms.
First time moms.
And for children that are 3rd and 4th, there's always that comparison. Your first brother potty trained at 6 months.
Yes.
No, which is an exaggeration.
At 1 year.
By 1 year, they were already using their underwear. Why don't you want to? And parents, please don't beat your child.
Each child differs.
Don't make it a negative experience by beating them. I say potty and you're not going, because that can also make them not want to go. And then they start getting scared.
And another way out also is to, if you have timings, we've talked about timings, then also maybe at home, don't let them wear the diapers. They go from time to time. Oh, go sit on the potties.
Yep.
And
underwear, regular underwear. Yes. When they pee on themselves a few times and they are cold, they will know that, okay, let's go pee in the potty.
A lot of literatures talk about not using the diapers when you want to try that. So get the underwears, let them wear it.
Yes.
So it's even fun for them to take it down, take it up. So you see them, they take it down, take it up.
And get their favorite character. If they like Spider-Man or Winnie the Pooh, get Winnie the Pooh.
Exactly.
And so it's like, don't pee on Winnie the Pooh. And they're like, okay.
They're happy not to.
That helps
them. That helps them. So as parents, it's what we have to teach them, our children, without any form of negativity, if I should use that word, without beating them. Just reassure the child, encourage the child. If the child wheezes, a thumbs up. If it doesn't wheeze, still a thumbs up.
Yes. And then cleaning. Sometimes you have to go after them to clean, especially if they've pooped. You need to use wipes that basically don't irritate their diaper area. And at the end of the day, everybody's happy.
They're good to go. And in the process, you also teach about hand hygiene. Yes. So they get used to, okay, I'm finished using the potty, time to wash your hands. And all of these are fun-filled activities for the kids, and they want to do it.
Yes. Yes.
Okay.
All right.
Thank you.
Thank you. Thank you.
Thank you so much. Thank you.
Moms, dads, for anyone who's watching, if you haven't subscribed to our channel, please go ahead and do so. And we'll see you next time.
Bye.
Thank you. Bye-bye.